Hi, I'm Paris, and I finished my last chemo infusion just over a month ago, and I am feeling so much better. The number one thing for me has been the anemia, the low red blood cell count. Mine was down by about a full third there at the end, and I could really feel it. You just don't have energy, and though I haven't had a blood test in the past couple weeks, I can tell both from how I feel and from the results on my Fitbit of my resting heart rate that my anemia has really improved. Before starting chemo, my resting heart rate was in the low to mid 50s, but it got bumped up to the mid 60s from the anemia. But here you can see over the past month, it's finally getting back down to normal, which is good news. But there are two other even bigger pieces of good news that I want to tell you about. One of them is in response to, well, what did 4 months of chemo do for you? Turns out quite a lot. The cancer that I'm dealing with is prostate cancer. To start with, my PSA, which isn't a direct measurement of the prostate cancer, sort of an indirect measurement, was up in the 30s before I started all this. And my most recent PSA blood test, about a week after the last chemo infusion, was down to 1.08, which would be a healthy PSA number for a man in his 30s. And just a week and a half ago, I had my post-chemo MRI, which I got the results of just a few days ago, and pretty amazing. The doctor was kind enough to show me the before and after MRIs sort of side by side so I could see the difference. And originally, there was what they call outside the capsule localized spread of the cancer, so it had gotten out of the prostate. But in the one I had done just a couple weeks ago, there's no sign of that. Now there doesn't seem to be any cancer outside of the prostate, and inside of the prostate, they give you this contrast dye as part of the MRI that they do, and the part that they think is cancerous is usually more brightly lit. So you can see these sort of brightly glowing areas in the prostate indicating the cancer, but in my most recent MRI, it's all just kind of gray and diffuse. Where did those, because I had two big bright areas previously, they're not there now. So between the PSA number reducing so much and the comparative MRI indicating so much less cancer, do I have much less cancer? It certainly looks like it. Do I have no cancer at all? It's possible, but they can't really tell you that. They could do another biopsy, which I would not be in a hurry to do. They take 12 needles and insert them into the prostate to get the samples, because they could do that now, and maybe all 12 would come back as we don't see any signs of cancer, but it doesn't mean there isn't some little clump of cancer cells in some corner of the prostate waiting for all the treatment to finish to start growing again. So to be on the safe side, the standard treatment, considering what point my cancer had gotten to before, is to have something else, basically to make sure there aren't any cells that are going to come back in the prostate and start this process all over again. So there was surgery, which was my original thinking, but the urologist that I saw here in Austin, and he said it'd be better to do the chemo first before the surgery to shrink it back away from those nerves that they'd like to spare. Gave me an extra 4 months to research and think things over, and what I've decided, and this is sort of the other good news, is that I've decided not to go the surgical route, and I've decided to do radiation, but more specifically what I really want to do, and I don't know yet for sure that I'm the candidate for it or that the insurance is going to pay for it, but what I really want is to do proton therapy. It's a form of radiation that's it's still radiation, and so you go multiple times and they send beams in from different angles and they zap your prostate good, including the area around the prostate, and they get the nearby lymph nodes. Now standard radiation uses something like a super high-powered X-ray machine to do the zapping, and the effectiveness of that is just about as good as the surgery. So they both, if you look at 5-year survival rates, 10-year survival rates, they're about the same, with the added advantage of you don't have to have surgery, fairly major surgery. It really is, with the risks of that and the extended time it takes to recover from that, and the danger that when they're in there cutting, they might cut something, they might nick one of those nerves they're trying to preserve and can leave you impotent and or incontinent. Now the standard radiation treatment can have those side effects as well, But from this extended 4 months I've had to research all this, I'm definitely much more comfortable doing radiation than the surgery. But within radiation, there's one that's quite a bit different, and it's called proton beam therapy. And it's not an X-ray machine shooting photons into you. Instead, it basically uses a particle accelerator. It's really cool technology. They collect, I guess magnetically, protons, and they feed them into a particle accelerator. These treatment, the treatment rooms are usually in the basement where they have these centers, and above you is a 3-story tall oval particle accelerator. You probably have heard of them, being this way in the ground. They take them and run them around the track and then fire them at other particles at almost the speed of light, and all kinds of cool stuff happens. Well, with the proton therapy, they get them up to over half the speed of light, and then they fire them into you. Sounds painful, but it's the same as standard radiation therapy. You don't feel anything when it's happening. But with the proton therapy, it seems, and there's doing clinical studies now to try to sort all this out, seems like fewer side effects because the proton therapy doesn't come out the other side. I don't understand exactly all the science behind it, but the protons release their energy mostly in the tumor, and then there's no energy left to come out the other side. With an X-ray, it goes right through you. So when they're doing high-powered X-ray, you've got some of the radiation is affecting the tissue on the way in, some of it is going to the tumor, and then the rest of it affects tissue on the way out. You don't have as much of that with the proton therapy. I read a book on that really changed my view and made me really want the proton therapy. The issue is not everyone's a candidate for it. There are only so many centers that offer it in the US in some larger cities. We don't have one here in Austin. So for me, the choice, I thought I was going to end up going to Houston for that. See, I'm wearing my NASA shirt. But it turns out where I've been receiving my chemotherapy, they're affiliated with the center in Dallas that has the proton therapy. And I'm very happy that after being referred by my oncologist, they've agreed to have me come up to Dallas next week for a consultation, and they're having all my scans and information sent up there, see if I'm a good candidate for it, so hoping I am, seeing if the insurance will pay for it, hoping that works out too. And if they accept me into that treatment program, I'll be commuting, I would imagine maybe sometime next month, daily, Monday to Friday, up to Dallas from Austin. It's about 3 hours each way, commuting up and back for 6 to 8 weeks. Now, all that driving and time away from home might seem like a lot of bother, a lot of trouble to go to, but if it reduces the chances of the side effects, the lifelong side effects, it's definitely worth it for me. My attitude towards the prostate cancer, I guess, has changed a little since my original diagnosis. It was advanced prostate cancer, and my numbers were awfully high, and the doctors I talked to looked kind of worried when they explained it to me. My thought at the time, my overriding thought is I'm going to do whatever is necessary to get rid of the cancer and be around for my family. But now that the chemo has been so effective, maybe I'm a little bit more spoiled because I'm certainly being a little bit more picky, saying, okay, if I'm going to be around all these extra years, I'd prefer not to be incontinent or impotent throughout that time. So I'm being sort of picky on which treatment I'm going to get. And even to me, that seems a little presumptuous. Like maybe I should just be thankful that they might be able to cure my cancer and not be picky about which treatment I'm getting. But I will be doing a separate video specifically on proton therapy for prostate cancer, my thinking about it, the book that I read about it. Considering that I found out I had prostate cancer back in August of last year, but I only heard about proton therapy in the past month, and only by chance, well, I'll tell you in the video about a Kindle recommendation of a book, it seems like it could definitely be a superior option for a lot of men, but I hadn't heard of it. I imagine a lot of men facing prostate cancer probably haven't heard of it either. I would like to spread the word and make sure men facing prostate cancer know they have that option to choose from also. So those are my good news announcements for today. I'm feeling much better. The chemo seems to have done a really knockout job on the cancer. And for the final part of my treatment, it looks like I have a chance anyway of getting into receiving the type of treatment I really want. And of course, thank you to my viewers and to everyone who's offered me support through all this. It's been a tough time, but all the wonderful comments from people has really helped. And I'll see you on the next review.
There are so many choices and you don't want to stress. You want your health food at home, receiving only the best. That's what we're here for, we give honest reviews. parristx.